Good day, Wonder Nurses. I'm Nurse Anne. I hope you're all doing well. Our video for today is all about the fundamentals of nursing. As always, you have 30 seconds for each question, then the correct answer and rationale will be given after you answer all the questions. So get a pen and paper, then let's start. Question number 1. Time's up. Don't forget to share this channel with your friends so we can help more aspiring nurses. You can also click the subscribe button below to keep you updated on our latest videos. Let's now proceed to the answers and rationale. Question number 1. Patient Whoops is receiving a transfusion of POC-RBC and begins to vomit. Her blood pressure is 90/50 from 120/80. Her temp is 100.8 degrees Fahrenheit orally from 99.2. Nurse Q determines that the patient may be experiencing which complication of a blood transfusion. The correct answer is B. Septicemia occurs with the transfusion of blood contaminated with microorganisms. Signs include chills, fever, vomiting, diarrhea, hypotension, and the development of shock. Circulatory overload causes cough, dyspnea, chest pain, wheezing, tachycardia, and hypertension. A delayed transfusion reaction can occur days to years after a transfusion. Signs include fever, mild jaundice, and a decreased hematocrit level. Finally, hyperkalemia causes weakness, paresthesias, abdominal cramps, diarrhea, and dysrhythmias. Question number 2. Nurse Rain determines that patient Moon is having a transfusion reaction. She stops the transfusion immediately. Then, the correct answer is letter D. If the nurse suspects a transfusion reaction, the nurse should stop the transfusion and infuse normal saline at a kV or rate while waiting for the further doctor's order. This maintains a patent IV access line and aids in maintaining the client's intravascular volume. Normal saline is the solution of choice over solutions containing dextrose because saline does not cause red blood cells to clump. Obtaining a culture of the tip of the catheter from the client is incorrect because cultures are performed when an infection is suspected. Then the nurse should not remove the IV line because there will be no IV access route. Question number 3. Patient Daku is brought to the ER due to blood loss related to an arterial laceration. The doctor ordered to transfuse fresh frozen plasma to replace fluid and blood loss. The nurse understands that the reason for transfusing fresh frozen plasma is 2. The correct answer is letter A. Fresh frozen plasma is often used for volume expansion as a result of fluid and blood loss. It will not specifically increase the hemoglobin and hematocrit levels. It does not contain platelets, so it is not used to treat any type of low platelet count disorder. It is rich in clotting factors and can be thawed and transfused quickly. If you want to learn more about blood transfusion, you can also check our video here. Let's continue. Question number 4. Nurse Gami checks the latest laboratory result of her patient. She noticed that the potassium level is 5.8. Which of the following ECG results that she expects to note based on the laboratory result? The correct answer is C. The serum potassium of the patient is high, which indicates hyperkalemia. ECG changes associated with hyperkalemia include flat P waves, prolonged PR intervals, widened QRS complexes, and tall peak T waves. Question number 5. Nurse Storm reads the progress note of her patient in the chart. The physician documented that the patient has insensible fluid loss of approximately 750 ml per day. The nurse interprets that this type of fluid loss can occur through. The correct answer is C. Insensible losses may occur without the person's awareness that occurs daily through the skin and the lungs, while sensible losses are those of which the person is aware, such as through wound drainage, GI tract losses, and urination. Question number 6. Patient Gamay has been receiving IV diuretics, and her nurse suspects that she is experiencing a fluid volume deficit. Which assessment finding is reliable to note and report with this condition? The correct answer is C. A fluid volume deficit occurs when the fluid intake is not sufficient to meet the fluid needs of the body. Assessment findings in a client with a fluid volume deficit include increased respirations and heart rate, decreased CVP, weight loss, poor skin turgor, dry mucous membranes, decreased urine volume, an increased specific gravity of the urine, increased hematocrit, and altered level of consciousness. The other options are the assessment findings for patients with fluid volume excess. Finally, question number 7. A nursing student needs to administer potassium chloride intravenously as ordered to a patient with hypokalemia. The nursing instructor determines that the student is unprepared for this procedure if the student states that which of the following is part of the plan for preparation and administration of the potassium. The correct answer is B. Here are the special considerations when administering KCl via IV. First, it must always be diluted in IV fluid and infused via an infusion pump or controller. It is never given by bolus because it can result in cardiac arrest. Dilution in normal saline is recommended and dextrose solution is avoided because this type of solution increases intracellular potassium shifting. The IV site is monitored closely because potassium chloride is irritating to the veins and there is a risk of phlebitis. Lastly, the nurse monitors urine output during administration and contacts the physician if the urinary output is less than 30 ml per hour. That's it for today. If you want to learn more, you can check some of my Q&A videos and many simple discussions on my YouTube channel. Keep on learning, nurses!
Thank you for listening. I hope you learn and understand something. If you want more videos, don't forget to subscribe. See you in the next video.